my name's Kimberly and I'm 20 weeks pregnant.
In my second trimester, I'm about 15 weeks.
I'm 21 weeks and 4 days.
I'm 21 weeks and 4 days.
I am 24 weeks along. I didn't realize that it literally affects every part of you, down from your ankles to your gums.
Your body feels like uneven, you're not walking normal, you're waddling, it's hard to sleep.
You're entering your second trimester, and you should congratulate yourself. The first trimester isn't easy, and you made it through. You can relax a bit now, because many pregnant women find the second trimester much easier. If you've had morning sickness or felt extremely tired, take heart. Those will likely ease up or go away entirely. Today, we'll talk about what the second trimester holds for you and your baby. We'll cover the many changes you may already be noticing in your body. Most are perfectly normal for an expectant mother, and we'll talk about what you can do to be healthy and comfortable. We'll even suggest ways to pamper yourself a bit during these next few weeks. We'll look at how you can manage some of those emotions brought on by pregnancy, and we'll talk about what symptoms you should report to your provider right away. Finally, we'll take a peek at your developing baby. Your baby will experience many changes in these next weeks. He's entering the second trimester with all of his major body systems in place. A complete little person who just has to grow and mature. But let's start with what changes you will be experiencing.
Yeah, fortunately, the second trimester of all the trimesters is usually probably the one that has the least amount of discomfort. So it's one that the moms look forward to the most, maybe, or enjoy the most, I should say. But there's still discomforts. It's not as if, I always tell moms that there's not a perfect trimester. They're all uncomfortable in a lot of different ways, but it seems like the second trimester is maybe the better of the three as far as discomforts go. There's a beginning of all the problems that tend to kind of crescendo in the third trimester, like the back pains and the stretch marks and the skin or dermatological problems, sometimes rashes on the face or cheeks and different things that are just annoying. This is a trimester where a lot of women can gain too much weight, particularly if they eat too much sugar or carbohydrates, simple carbohydrates. And so the thing that distresses a lot of women in this trimester is the large amounts of weight gain that are possible during this part of the pregnancy.
The second trimester spans weeks 14 through 26. What's happening to your body and your feelings? In these weeks, you'll notice a rounder baby bump, and soon you'll feel your baby moving and kicking. Let's look at what you can expect so you can set your mind at ease. Your body is going through a lot of changes to make room for your baby and to give her what she needs in order to develop. Your baby is also going through some changes to get ready for delivery. Even though most of these changes are to be expected, let's look at the things you can do to make yourself more comfortable. Most of the changes and discomforts you'll experience can be helped with a little extra self-care and rest.
I've had a lot of back pain, definitely gingivitis. My teeth will bleed for no reason. Weight gain and weight loss.
I didn't know I was pregnant until about 15 weeks, I believe. It was like, wow, I've already went through the hard part, because in my first two pregnancies, the first trimester is usually the hardest. So I was kind of like, wow, okay, I'm already done with the speed bump.
My body remembers what it's like to be pregnant. It's just like, oh yeah, everything's just like that.
You may find that your tummy itches. That can be uncomfortable, but it's nothing to worry about. The itching is caused by your skin stretching and tightening as it expands with your growing uterus. Try wearing loose clothing made of natural fibers like cotton to keep from irritating your skin. Try using unscented lotions to keep your skin moisturized as it stretches. You can also use an anti-itch cream, such as calamine lotion, for some relief. If the itching becomes severe, is accompanied by nausea, vomiting, loss of appetite, fatigue, or jaundice, then contact your provider.
I don't know why in pregnancy your stomach itches so much, but it definitely itches starting in the second trimester, and I've been putting cocoa butter on. I try not to itch it because I've heard that you can get stretch marks from that, but I definitely still need to itch.
Your growing belly may also lead to brown, red, or pink streaks on your tummy and breasts. These are the dreaded stretch marks that many women get and hate during pregnancy. But even though stretch marks are normal, it's understandable why you may not like how they look. You can help prevent or minimize stretch marks by drinking lots of water, taking your vitamins, exercising, and by not gaining more weight than is healthy for your pregnancy. Also, creams that contain Centella asiatica extract, vitamin E, and collagen elastin hydrolysates have been found to prevent or lessen stretch marks in some women, so look for those ingredients when selecting a cream. Any stretch marks you do get should fade after delivery. If they don't, then you can see your dermatologist. You might notice bits of darker skin on your upper lip, your nose, and other places on your face. This is known as the mask of pregnancy. Your pregnancy hormones are responsible for these darker patches. They typically fade a few months after you have your baby when your hormones settle down. In the meantime, wear sunscreen and a hat when outdoors.
Mask of pregnancy is generally more of like a almost like a rash. It's like a pigmentation of the mom's cheeks and face, and it's usually thought to be from a progesterone effect, kind of like the little line that you can get up the middle of your stomach, the linea nigra. This is sort of somewhat related to that. It's a pigmentation change, and not all women get it, but some women definitely notice it. And sometimes they don't realize that's from the pregnancy, but it's definitely probably from the elevated progesterone levels that you get when you're pregnant.
It's natural that you're gaining weight as your baby grows, but that can make your back or legs ache. You may be feeling out of sorts from the demands pregnancy puts on your body. To help ease these aches and pains, get some rest and apply gentle heat to the aching areas. Consider using a heating pad to help ease those aches.
Leg aches are very, very, very real in your second trimester, and I forgot about it with my last 2 pregnancies. It's really hard to go to sleep at night because your thighs and your calves will hurt so bad, and there's not really a reason why it's hurting.
My back, lower back, is a bit swollen, and I have to sit at a desk all day at work, so definitely having a pillow behind my back helps a lot. And just lifting my feet as much as I can whenever I can put my feet up, I love to.
Oh my gosh, yeah, it's just been killer, and sometimes it's better some days, but for the most part, I do any kind of real walking, and it really is painful.
You've probably noticed your breasts getting larger. They may feel full and sensitive. These changes are the signs that your breasts are getting ready to make milk in order to feed your baby. By the end of this trimester, your breasts will be ready to feed your baby if she comes early. You can ease the discomfort by wearing a maternity bra that offers good support. Your breasts may also begin to leak a little and even leave some wet spots on your bra or shirt. That's something no mom wants to see. The leakage is called colostrum, the first milk your baby will eat after birth. Carry nursing pads with you so you can tuck one inside each cup of your bra to absorb the fluid and protect your clothing. If you don't end up breastfeeding, then your milk will dry up about 7 to 10 days after you deliver the baby, and the leakage will stop then.
A lot of tenderness, that kind of has eased up, but obviously they have gotten enormous. Yeah, I have had some increased nipple sensitivity that has been really not very pleasant. Feels like it's going to be chafing, and so I like to wear things that are a little more close fitting, a better fitting bra, or maybe like a tighter tank top underneath my sweaters so that there's no rubbing.
Your hormones are changing, and that may cause a darker vertical line to appear that extends from your belly button down to your pubic hairline. If this line bothers you, then keep your tummy covered or use a good sunscreen if you go out in the sun. But it's good to know that this fades after you've had your baby, and your hormones adjust again. You might also feel concerned if you notice a white, milky discharge from your vagina. That too is normal during pregnancy, even if it's a bit inconvenient. If the discharge itches, burns, or has a bad odor, then contact your medical provider. However, don't douche or use tampons, but it's okay to use panty liners.
Any bleeding, of course, or any leaking of any kind of fluid out of the vagina that's not particularly what they consider a normal vaginal discharge during the pregnancy, they should let us know right away. It'd be very unusual for them to have, let's say, a ruptured bag of water in the second trimester, but it's not impossible. Test 24 weeks, then there's a small danger of preterm labor. So if suddenly the mom would feel a certain increased amount of pressure or a sense of contractions, tightenings of her stomach that would be happening fairly frequently, even in the second trimester, that could happen. We want them to let us know right away.
Hemorrhoids and varicose veins are another change that can come with pregnancy. They're both caused by the weight you're gaining and by the increased volume of blood your body is building up. Varicose veins look like swollen veins in your legs. To help avoid them and decrease swelling, sit with your legs and feet raised and don't wear tight knee-high stockings. Hemorrhoids are not fun to talk about. They may make you feel like you're the butt of an unkind joke. But let's agree to talk about them now, so we can cover what you can do to be more comfortable. Hemorrhoids are painful or itchy swollen veins around your anus. To help prevent them, stay well hydrated and eat a healthy, balanced diet, especially one rich in fiber. Avoiding constipation is the main way to control or avoid them. To ease the pain or itching, try not to strain when having a bowel movement. Your hemorrhoids will eventually go away once you've had the baby and your weight gets back to normal. Your tissues might swell a bit too, and that can make your hands feel numb or tingly. While it's distracting, it's nothing to worry about. To help with the numbness or tingling, take more frequent rests from your computer or typing on your phone. Your changing hormones can also lead to tender or bleeding gums and an increased risk of tooth decay. Some women even see pregnancy tumors appear on their gums, most often between their teeth during the second trimester. Don't worry, they're not cancer and they will go away after your baby is born. However, poor dental health can hurt your overall health and your baby's too, so it's important to continue to brush and floss your teeth regularly. Tell your dentist that you're pregnant and schedule dental checkups throughout your pregnancy to keep your mouth healthy.
Gingivitis, which was something I didn't know could be affected, but it is.
That is something that no one else has told me before until I went to the dentist. When you brush your teeth, even if you're being so gentle, your gums can bleed.
My gums started bleeding. I'm like, what? This never happens. And I never even realized, I never knew that was a pregnancy thing, but it happened to me.
Okay, that's a lot of physical changes, but it's good to know that they're all normal for a mother in her second trimester. Now let's talk about your emotions. Many pregnant women are surprised at how emotional they feel. You may find yourself getting weepy over a commercial. You may even feel like your emotions are a roller coaster, up one moment, down the next. You could feel anxious, irritable, or extreme joy and happiness. No need to feel embarrassed. These tender feelings are so common that most people just expect them in a young mother-to-be. Your changing hormones are what's causing these emotions. You may also be feeling more tired, more uncomfortable, and a little self-conscious about the changes in your body. All these can lead to feeling down or on edge. What will make it better? A little self-care. Get more rest and sleep. Eat a healthy diet and get some low-impact exercise if your provider allows it. And finally, ask for support from your partner or from friends or family who are supporting you throughout this pregnancy. Tell them how you're feeling and let them offer sympathy, understanding, insight, and maybe a little humor as well. It's okay if you're a bit emotional, and it's likely those around you will understand. But it's also important to recognize when emotional challenges become more serious. If you feel depressed for most of each day or have thoughts of harming yourself, you should contact your provider immediately. Untreated depression or anxiety during pregnancy can lead to postpartum depression and anxiety.
I actually am very, very, very hormonal this pregnancy, and I do talk to someone once a week, kind of just venting and getting any stressors out. I also do self-care. Once a week I'll do a face mask and I'll pamper myself, and that will be my me time to really focus on myself.
Well, at first, I would cry for anything. If he just said something a little bit wrong. I'm bursting into tears. But now, more that I'm in the second trimester, I feel a lot better all the time. So I'm generally happy.
I can say anxiety gets extremely high during the second trimester. That's, at least for me, it does, because I know that it's coming.
I just felt really emotional for this whole entire pregnancy. Just last night, I had to read a whole bunch of essays that some 6th graders had written for a class that I taught. And I was getting choked up and emotional over it because I'm like, they really understood what I taught them. But yeah.
I cry, I get mad very fast, or I get very happy, very emotional, start crying out of nowhere. So my fiance's like, relax.
In fact, while many expectant women experience changes that are normal, it's also important to recognize those that aren't. Contact your provider immediately if you see or experience bleeding from your vagina, sudden or severe swelling in your face, hands or fingers, or sudden weight gain, painful headaches, painful cramping in your tummy or abdomen, fever and chills, vomiting or regularly experiencing nausea, burning when you urinate, or if you are dizzy or things look blurry. Remember, these are signs that you should contact your provider. But if your tummy itches a bit and you have some discharge from your breasts, it's nothing to worry about. Stretch marks, a dark line down your abdomen, or brownish areas on your face are all perfectly normal. Hemorrhoids and varicose veins, yep, normal. Tingling in your hands and a clear or milky discharge from your vagina are normal too. But again, you should always contact your provider if you're concerned. You may be looking forward to delivering your baby or being done with pregnancy. What can you do to make your pregnancy easier and be healthy now and after your baby is born? First, you should eat a diet that provides the nutrients and fiber that you and your baby need. You will need more protein, iron, calcium, and folic acid than you did before pregnancy. You also need a few more calories, just be sure not to gain more weight than your provider has suggested. As you enter your second trimester, your metabolism changes to one similar to a type 2 diabetic. Your hormones make you insulin resistant, which means that sugary and starchy foods will stimulate more insulin release than you would have normally. Simple carbs are not healthy foods and will make you gain more than the normal 1 pound per week gain during this time of pregnancy. You should avoid them except for special occasions.
There's biological reasons for this, but there's hormones that are in her system that are not normally in her system that cause her to be insulin resistant. And by insulin resistant, I mean more like a type 2 diabetic. If you're familiar with like the adult onset type of diabetes, that not the juvenile type of diabetes, but the adult onset type of diabetes where you're resistant to insulin, the pregnancy hormones make a pregnant mom resistant to insulin. So what that means is that when she eats sugary things, particularly like simple carbohydrates like white flour, white sugar, and potatoes, it stimulates a larger release of insulin than she would normally have from her pancreas. And so she gets a flood of higher amounts of insulin with the same amount of sugar that, let's say, her husband is eating, but yet she will have more insulin released and therefore will store fat more easily and will gain more weight, unfortunately. So it doesn't seem fair that, you could have the same ice cream sundae and you could gain more weight, the same amount of calories. You think that doesn't seem fair, but if you have a higher degree of insulin release from your pancreas, then your body's in this fat storage mode and it just takes that and stores it as fat.
Next, you need some exercise. Plan to get 2.5 hours each week of gentle exercise that gets your heart rate up, such as walking, swimming, or stretching. If you're used to it, dancing or cycling can be fun too, but be careful as your balance may be a little off with the growing tummy. You don't want to fall. Exercise helps make labor and delivery easier, and it helps you get back to your pre-pregnancy weight. But always check with your provider to make sure exercise is safe for your pregnancy.
But in the second trimester, the energy's coming back, particularly after about 16 weeks. They begin to feel kind of a surge of energy, and we kind of encourage them to get out and exercise. And we don't really recommend that they train for a marathon or some long distance race or do anything extremely strenuous, but But we do recommend some sort of regular exercise several times a week, like, for example, walking, hiking, bicycling, or something that is not going to raise their heart rate more than the 140s. So if they keep their heart rate in the 140s, young people particularly can handle that kind of, but if the heart rate starts to get over into the 150s, your body will begin to shunt blood flow from the internal organs to the extremities, and we don't want that to happen because, of course, the uterus is a central organ and it needs all the blood supply it can get, and that's where the baby's getting the blood supply. So we don't want them to overdo it. And fortunately, most exercise equipment nowadays has some sort of heart rate detection device on it, and most people's watches almost do nowadays, and so it's fairly easy to keep track of the heart rate. But if not, it's just the old-fashioned, feel your pulse, and if you're in the 150s, you need to decrease the intensity of your exercise regimen.
You might be wondering if it's okay to continue to have sex while you're pregnant. The answer is probably. Most women can have sex in the second trimester without problems. It's always best to ask your provider if having sex is safe for your pregnancy. Here are some things you shouldn't risk doing while you're pregnant. Don't smoke. Don't do any street drugs. Don't drink alcohol.
It's important to cut out all alcohol during your pregnancy. Alcohol is one of those substances that can cause birth defects. Certain drugs are more likely to cause placental abruption than others. For example, cocaine is one in particular that's super high risk for abruption, which basically means that the placenta can tear away from the side of the uterus. Obviously, the placenta needs to be firmly attached to the uterus to supply oxygen and nutrients and water to the baby, and if the placenta would begin to tear away from the side of the uterus, and disastrously, if it completely tore away from, then the baby has no blood supply and the baby will not survive. Risk of having seizures and risk of having nutritional deficiencies and difficulty in feeding and growing and all of those things that happen with any kind of narcotics withdrawal.
If your provider agrees, then some caffeine is okay in the second or third trimester, but it's best to avoid energy drinks altogether. In fact, you should have the equivalent of no more than 1 12-ounce cup of coffee per day, which is less than 200 milligrams of caffeine. Finally, avoid radiation exposure. If your doctor or dentist wants to take x-rays, then be sure they know that you're pregnant so that they can protect your tummy from any exposure to harmful radiation. Are you curious about the changes in your baby? You can see your tummy growing rounder, but there's so much more happening. In the second trimester, your baby begins to look more like a baby. Her beautiful face develops, including eyelashes and eyebrows, and she may even begin to resemble you or her father. Your baby is now developing toenails and fingernails. He's beginning to move, although you may not feel that movement until around your 17th to 20th week. Your baby's brain is continuing to develop. During the second trimester, her brain has about 1 billion nerve cells. At times, he will sleep, and at times be awake and active. When you feel her moving, it's often because your baby wants to stretch after a nice long nap or has the hiccups. And toward the end of your second trimester, your baby can hear sounds from outside the womb, including your voice. By week 24 and on, if your baby was delivered, he could survive with the help of medical technology.
Ultrasounds are the most exciting part of a pregnancy. I think it changes your whole perspective when you go to that first ultrasound too. Because even the last one, I saw him sucking his thumb and kicking his umbilical cord, and you're not thinking that's happening inside of you until you see it. And then it's like, oh my gosh, there's a little baby in there moving around. It makes the experience so much more real, and it's exciting.
When I had my ultrasound, it really made things real for me. I cried like every time. I had 3 ultrasounds so far, and it's definitely just the miracle of life is amazing. You see this little tiny ball inside of you, and then it grows up and it has arms and legs and a big old head, and it's so adorable.
And I'm really excited to get farther along so I can see his face and his facial features and what he's gonna look like when I give birth.
There's just something about hearing the heartbeat that just makes everything so much more real and special.
Now you know what to expect in your second trimester. It's good to know that many women find this second trimester more comfortable than the first. Remember to take time to pamper yourself. Your body is working hard to nurture your baby. You deserve some nurturing too. Keep in mind in these next weeks, much of what you'll experience is normal for a pregnant woman in her second trimester. But if you're ever concerned, then give your provider a call, both to set your mind at ease and to be sure things are going just as they should be.